Epileptic seizures can present in many different forms, making proper recognition and management absolute. This is particularly true in dental and medical settings where a patient's safety is paramount. Understanding the various types of seizures is the first step toward providing effective care. Let's begin with partial or focal seizures. These originate in a specific area of the brain. In simple partial seizures, the person remains fully conscious and aware. The symptoms can vary widely depending on the brain region affected and may be motor, sensory, autonomic, or even psychic, such as a sudden feeling of fear or joy. Complexe partial Seizure, on the other, evolve and alter into consciousness. The person might appear confused, dazed, or unresponsive. These are often preceded by an aura. It can manifest as a sudden, abnormal sensory experience, like an unpleasant taste or smell, a strange feeling of déjà vu, or seeing flashing lights. Following the aura, motor manifestations may appear. These are typically primitive, uncoordinated, and repetitive movements known as automatisms. You might see lip smacking, chewing motions, fumbling with clothing, or aimless jerking of a limb. Partial Seizure, both simple and complex, usually last for about 1 to 3 minutes. Next, we have absent seizures, historically known as petit mal seizures. These are characterized by a sudden, brief suppression of consciousness. The person will abruptly stop all activity, assume an immobile posture with a blank stare, and may exhibit minor, automatic movements like rapid blinking or slight lip movements. A key feature of absent seizures is their short duration, typically lasting only 5 to 30 seconds. There is no warning or prodromal phase, and importantly, no postictal period of confusion afterward. The person returns to normal activity immediately, often unaware that anything has happened. Now, let's discuss tonic-clonic seizures, also known as grand mal seizures. These are what most people picture when they think of a seizure. They can sometimes be preceded by a prodromal phase, which can last for hours or even days. During this time, the individual might experience increased anxiety, depression, or irritability. Just before the seizure, a brief or a lasting only seconds may occur. The seizure itself begins with the preictal phase, marked by a sudden loss of consciousness. The person may collapse, and you'll see generalized myoclonic jerks, which are brief, shock-like muscle contractions. An epileptic cry might be heard, caused by air being forced out of the lungs as the muscles contract. Significant physiological changes occur. Rapidly, the heart rate increases. Blood pressure can shoot up to double its baseline, and you might observe cutaneous vascular congestion. Piloerection or goosebumps upward, deviation of the eyes, and dilated pupils, known as mydriasis. A brief period of apnea, where breathing stops, also occurs. This leads into the ictal phase, which has 2 parts. First is the tonic phase, a period of sustained, generalized muscle contraction. The entire body becomes rigid and stiff. This intense muscle contraction can interfere with breathing, leading to dyspnea and cyanosis, a bluish discoloration of the skin due to lack of oxygen. The tonic phase is relatively short, lasting about 10 to 20 seconds. It is immediately followed by the clonic phase. Here, the sustained muscle contraction gives way to alternating periods of contraction and relaxation, producing the characteristic jerking movements. Breathing becomes heavy and irregular, and frothy saliva may appear at the mouth, sometimes tinged with blood if the tongue or cheek has been bitten. The clonic phase typically lasts for 2 to 5 minutes. The muscles relax completely, and the person may be limp and unresponsive. This is a period of deep confusion, drowsiness, or sleep as the brain recovers. Full recovery from a tonic-clonic seizure usually takes 1 to 2 hours. A critical and life-threatening condition is status epilepticus. This is a medical emergency. It's defined as a continuous seizure lasting more than 5 minutes, or a series of recurrent seizures where the person does not regain consciousness in between. During status epilepticus, the individual is unconscious and may be cyanotic and diaphoretic, meaning they are sweating profusely. Hypothermia can develop, with body temperature rising as high as 41 degrees Celsius or 106 degrees Fahrenheit. Tachycardia and cardiac dysrhythmias are common, and severe hypertension can occur, with blood pressure reaching alarming levels like 300/150. So, how do you manage a seizure, especially in a clinical setting? If a patient begins to have a seizure, your first priority is their safety. Stop all dental or medical treatment immediately. Position the patient in a supine or flat position. If possible, gently turn their head to the side or roll their entire body into a lateral recovery position. This helps keep the airway clear and prevents them from inhaling any saliva or vomit. Clear the immediate area of all instruments and sharp objects. If you can do so safely and quickly, remove any dental appliances from their mouth. However, and this is crucial, do not try to place anything in the person's mouth like a bite block or your fingers. This is a dangerous myth and can cause serious injury to both the patient and you. Also, do not forcibly restrain the person. Use only light, passive support to guide them and prevent them from hitting hard objects. You must call emergency services if the seizure lasts for more than 5 minutes, if seizures repeat without the person regaining consciousness. If it's the person's first ever seizure, if they appear cyanotic or have been injured, or if they do not start to regain consciousness after the seizure stops. Any case of suspected status epilepticus always requires emergency care. After the convulsion ceases, management continues. Maintain the patient's airway. Provide oxygenation if you are trained and equipped to do so. Monitor their vital signs, heart rate, breathing, and blood pressure. Expect the patient to be confused, disoriented, or drowsy. Speak calmly and reassure them as they slowly recover. Finally, the emergency management of status epilepticus is time-critical. Ensure 911 has been called immediately. Administer high-flow oxygen via a non-rebreather mask. The preferred drugs are benzodiazepines, such as lorazepam given intravenously or midazolam given intramuscularly or intravenously. Diazepam can also be used, but it is generally less preferred due to its shorter duration of seizure control and higher risk of respiratory depression. If the seizure persists after the initial dose, a repeat dose, usually at half the initial amount, may be given while facilitating emergency transport to a hospital. Early recognition and correct, calm management of epileptic seizures can prevent injury and are truly life-saving skill. Thank you for watching. Be sure to follow for more essential medical education.